Imagine a world where a simple, inexpensive medication could significantly reduce the chances of cancer returning after surgery. This is not just a dream. It's a reality revealed by a groundbreaking study led by a team from Sweden's Karolinska Institutet and Karolinska University Hospital. Their recent randomized clinical trial has demonstrated that a low dose of aspirin can cut the risk of colorectal cancer recurrence in half for patients whose tumors carry a specific genetic mutation. Colorectal cancer is a major health concern, with nearly 2 million new cases diagnosed globally each year. Alarmingly, between 20 to 40% of these patients may develop metastases, which complicates treatment and increases mortality rates. Previous observational studies hinted that aspirin might play a role in lowering the risk of certain cancers, including the recurrence of colorectal cancer in patients with mutations in the PIK3 signaling pathway, a pathway crucial for regulating cell growth and division. When these genes are mutated, they can lead to uncontrolled cell growth and cancer. However, until now, the evidence was inconsistent, and no randomized clinical trials had confirmed these findings. To fill this gap, the ALASCCA trial was launched, and its results have now been published in the prestigious New England Journal of Medicine. In this extensive study, over 3,500 patients with colon and rectal cancer from 33 hospitals across Sweden, Norway, Denmark, and Finland participated. Those whose tumors exhibited a specific mutation in the PK3 pathway, found in about 40% of colorectal cancer patients, were randomly assigned to receive either 160 milligrams of aspirin daily or a placebo for 3 years following their surgery. The results were striking. Patients taking aspirin experienced a 55% reduction in the risk of cancer recurrence compared to those who received the placebo. Anna Martling, the study's lead author and a professor at the Department of Molecular Medicine and Surgery at Karolinska Institutet, emphasizes the significance of this research. Aspirin is being tested here in a completely new context as a precision medicine treatment. This is a clear example of how we can use genetic information to personalize treatment and at the same time save both resources and suffering, she explains. But how does aspirin achieve this remarkable effect? The researchers propose that aspirin works through multiple mechanisms. It reduces inflammation, inhibits platelet function, and slows tumor growth, collectively creating an environment that is less conducive to cancer development. While the exact molecular connections are still being explored, the findings strongly support the biological rationale behind using aspirin in this context, particularly for genetically defined patient subgroups. Martling believes that the implications of this study could be far-reaching, potentially reshaping treatment guidelines for colorectal cancer on a global scale. One of the most compelling aspects of aspirin is its accessibility. It is a well-established medication that is both widely available and significantly cheaper than many modern cancer therapies. Aspirin is a drug that is readily available globally and extremely inexpensive compared to many modern cancer drugs, which is very positive, she notes. This study was partially funded by the Swedish Research Council and the Swedish Cancer Society, highlighting the importance of continued research in this area. As we reflect on these findings, it raises an important question. Could a common over-the-counter medication like aspirin be the key to improving outcomes for cancer patients? What are your thoughts on using such a widely available drug in a new, targeted way? Join the conversation in the comments below.